Good evening, everyone. This is the webinar for November the 19th, 2013. As always, this is sponsored by the American Functional Medicine Association. We are anxiously awaiting our first annual Functional Medicine Conference that is going to be on March 6th through the 9th. And for the last several weeks, we have had one of our speakers to come and to give us a little uh, taste of what they are going to be speaking about. And tonight is no different. We have Dr. Kieran Dunston. I have Dr. Dunston's uh, introduction here, and I'm going to get to it. But Dr. Dunston is someone that I met around 2008, and I met her at the Life Extensions seminar in Florida, and she is someone who heard the lecture, and one of my lectures is how to change your practice. And if some of you guys have heard that, I know you may know that the first thing that I say is that you need to change yourself. Well, a lot of people say they want to change, but they don't really do the things that they need to do to change. But Dr. Dunston is one of those people who took it to heart and changed herself. And I always say, if you change yourself, you'll change your practice, you'll change your life, you'll change your future if you work on yourself first. And I'll let her talk about how all of that happened. But she is someone who said she was going to do something and she did it. I've heard a lot of doctors do a lot of talking, but not all of those doctors actually do what it takes to change, but Dr. Dunston is one of those people. And I'm so happy that she accepted the invitation to come and speak, because sometimes I think that we have speakers at these seminars and you think that they are at a level that you cannot attain. Dr. Dunston is someone who started out like you. She used to come to all of my webinars when I used to give them in the past. She was always there, and she put it into action. And so I'm very proud of her, and I'm very happy for all of the success that she is having. So let me go to the official introduction. Dr. Dunston is a board certified. Is board certified and specializes in functional medicine, natural weight loss, bioidentical hormone restoration. She was born and raised in Manhattan. Dr. Dunston received her undergraduate degree in psychology at Bryn Mawr College in Bryn Mawr, Pennsylvania. I hope I'm saying that right. She received her medical degree from Jefferson Medical College in Philadelphia, Pennsylvania in 1992. Dr. Dunston completed her residency in obstetrics and gynecology at the Medical Center of Delaware in 1996 and then moved to Savannah, Georgia, where she practiced obstetrics and gynecology for 15 years. In 2008, Dr. Dunston became aware that most of what mainstream medicine offered to patients, including drugs and surgery, did not actually fix the cause of the problem, it just masked the symptoms. She discovered that special testing, not commonly available to most people, successfully located the cause of health symptoms and diseases, and that natural remedies were effective in ameliorating not only the symptoms of disease, but also the diseases themselves. She discovered the reason she had gone into medicine in the first place. After successfully curing her own medical conditions and symptoms, she began integrating these treatments into her practice with tremendous results. In July of 2011, Dr. Dunston retired from the practice of obstetrics and gynecology to pursue her passion for functional medicine and truly helping people to achieve optimum health on a full time basis.
Well, thank you
Mhm.
for that wonderful introduction, Dr. Taylor. It is my honor to be asked to speak at the American Functional Medicine Association. I'm very excited about speaking March 6th or 9th. I love speaking about weight loss, and because it's a topic that's near and dear to my heart, because as you said, I lost a lot of weight, and I'm going to talk about that tonight and whet everybody's appetite to come hear the full presentation at the seminar. So I'm going to be talking about understanding weight loss at the seminar, and I want to talk a little bit about that. I really do walk the walk, and that's one of the reasons I think I've been so successful with my patients, because I don't just tell them what to do, I do it also. So that gives me a lot of street cred with my patients. They really know that I believe what I tell them to do. And I'm going to tell a little bit about my story. So I practiced OBGYN for 15 years and really drove myself into the ground. I got to weigh about 243 pounds. I suffered with chronic fatigue syndrome, fibromyalgia, depression, and really didn't have much of a life. And I had to work, and I had to eat, and I had to sleep, so I did those things. But I didn't really have to have a life, so I didn't. And I didn't really know how to get myself better. Everything that I tried in mainstream medicine didn't get me better. I would run tests, I'd run thyroid tests and insulin and some different things, and they would come back normal, and I'd go to my doctor and she'd run tests and she'd say, well, they all look normal. And I really didn't have any hope. Nothing came back abnormal. So one day, one of my patients gave me one of Suzanne Summers' books, and she said, well, you have to read this book. And I said, thank you very much. And I took it home and put it on my night table. And I said to my then husband, I'm not going to read that book. She's from Chrissy on Three's company. What's she going to teach me? I'm a board certified physician. And I was such a snob at that time and didn't read it. But then one day I knew I was going to be home in bed, and I said, well, let me just look at it so I can tell her I looked at it and give it back to her. And I picked it up and started reading it, and it was actually very interesting. And before long, I was reading it like it was the Da Vinci Code. And I finished that book that day, and I learned a lot that I didn't know about medicine, and I learned about functional medicine. And I committed that day to learn everything that I could about this medicine I had never heard of, called functional medicine. And the first thing I decided to do was go to a functional medicine conference, and it was a life extension conference in Florida. And I made a reservation and I went, and that's where I heard Dr. Taylor speak, and my entire paradigm about medicine changed when I heard him speak. And there was hope for me at that conference that I learned about, because I learned about tests that I had never heard about cortisol testing and hormone testing. And I started doing this testing, and I started finding out that I had hormone imbalances and other imbalances that I could correct with natural measures, with vitamins and minerals and herbs. And I started getting better, and I started losing weight, and I started going to more conferences, and I started getting better and better and better. I started learning about stool tests. I went to one of Dr. Taylor's conferences in Atlanta, and I learned about stool testing. And I started finding abnormalities there and fixing those. And I learned about food allergy tests, and I started eliminating foods I was sensitive to, and started losing more weight. And before long, I had lost 100 pounds. I no longer had chronic fatigue. I no longer had fibromyalgia, depression, and all the other things that ailed me. But more than that, my professional life transformed as well. My patients wanted to know, what are you doing? We want to do it. So I started doing these tests with them, and I started treating them. And then their lives started transforming. And before long, that was really all I wanted to do. I didn't want to give them drugs. And that's what I started doing. And as Dr. Taylor said, I retired from OBGYN in July of 2011. So this is me now. And my life has been transformed physically and professionally. And like I said, my patients really listen to what I say because I do it. And when I talk to physicians, I really tell them, you've got to do what you tell your patients to do, or you really won't get any traction with them. So like Dr. Taylor said, you really need to take your own advice. So in terms of weight loss, what I'm going to be talking about at the conference, I'm not going to give you all the details. You need to come to the conference to get all the details. But I'm going to be talking about the 4 levels of dysfunction that must be addressed for weight loss. Mainstream medicine has said for years, basically, that the body is a bank account or a math equation. You've got to eat less and exercise more. And when I see patients, I ask them, how many of you have been told this lie by physicians? And everybody raises their hand. I mean, I've been told that lie. I told that lie for years to my patients. Well, you got to eat less and exercise more. And that's basically a lie. Now, is there some degree of exercise that needs to be done? Of course. Is there some degree of moderation in diet that needs to be had? Yes. But that is not the only issue here. The body is a complex biochemical equation, and you've got to address all of these other issues. I see people all day who exercise regularly and eat in moderation, and they say, I can't lose a pound, doc. I can't lose it. And there are reasons for that, and these are the reasons that we address with them. So level 1, and these are the things we're going to talk about, are hormone imbalances and neurotransmitter imbalances. Level 2 are toxicities. That includes inflammation. Level 3 are nutritional deficiencies. Level 4 are mental, emotional, and spiritual imbalances. So briefly, we're going to talk about the hormones. You know, there are lots of hormones in the body. There are 7 major hormones that I focus on when I work with people. And what I like to do when I work with people, people who have weight issues want immediate results. If you don't give them something pretty quickly, they're going to be disheartened, because most of these people have tried every diet that's out there. And when I start working with them, I usually ask, well, how many of you have tried one diet? How many of you have tried 2, 3, 4, sometimes 5, 6, 7? So they're pretty demoralized, and they're very reluctant to try again, because nobody likes failure. Failure is not fun. And if you don't show them pretty quickly that they can have success with this, they're going to be out the door. So I do like to ultimately do custom testing like I did, but I like to give them something right up front that's going to give them results within a week's time, so that they could lose 3 to 5 pounds within a week and say, oh yeah, this is going to work. So I give them a one-size-fits-all. I call it a dress off the rack, that they can use and get results within a week. So it's going to balance their hormones and neurotransmitters, address some toxicity, nutritional deficiencies, and some mental, emotional, spiritual issues. So I give them different supplements and an eating plan that will address these things. And I have them do that for 6 weeks, and we'll talk about at the conference, what is this great program that you can give them that in 6 weeks is going to have them lose 20 to 30 pounds and address some of these issues, so that you can gain their confidence and get them on the road to losing weight. And we'll talk about what are these different issues on these different levels. And then what I have them do during that 6-week period is I have them do the tests, so that you can start customizing their program and finding out what are their specific hormonal imbalances. You know, what are their sex hormone imbalances? What are their cortisol imbalances? What's their DHEA imbalance in terms of their hormones? What are their specific toxicities, especially from the gut? That's where a lot of the toxicity comes from in the body, their food sensitivities, or maybe infections they have in the gut with parasites or yeast. What are their personal nutritional deficiencies, which 70% of Americans have, but it's way higher when you're talking about people who have overweight or obesity. And I call that the couture dress. We start making them a custom dress. So they're undergoing this custom testing while they're losing weight in the first phase. And then when they're done phase 1, they go into phase 2, and then you start tailoring their program more specifically to what their specific needs are. And they really like that because people are all different. They don't all need the same thing. Yes, they all need more knowledge, tools, and support. And I like to explain to people, because they've been so demoralized and they've failed so many times, that it wasn't their fault, because they didn't have the proper knowledge, tools, and support. They didn't know that the body was a complex biochemical equation. They were told that it was a bank account, too much in, not enough out. And so it's not their fault that they failed. And that I really do a lot of education with my patients, and you really should too. You really need to take the time to educate them about their body and teach them, what are these hormones? How do they work in the body? Because if they don't understand how the body works, and you just tell them, here, take this because I told you to do it, it's going to go in one ear and out the other, and you're going to be basically patronizing them just like mainstream medicine does, and you're going to have the same level of effectiveness. So I think with with the knowledge that we have in functional medicine, part of our responsibility is to impart that knowledge to the patients and really empower them to make better choices for themselves. So a large part of my time is spent educating patients and giving them the knowledge. And once they have the knowledge, what I tell them is, it wasn't your fault before, but guess what? Now, if you don't do it, guess what? It might be your fault, because now you have a responsibility, now that you have that knowledge. And I hold them accountable once they have that responsibility. And then I tell them, you didn't have the proper tools. And what are the tools? You have supplements, you have a specific way of eating. And then once they go into phase 2, I like them to exercise. And so you have ways of exercising, and that's a tool. And I like them to start meditation, and I give them meditation CDs that I've created. And I've created a mental and emotional and spiritual workbook with audios that they listen to, that really give them tools about how to navigate that part of their life. And so those are tools that they can use. So I hold them accountable for using that. And then support. So that's another thing which that I'll be talking about during the conference. Is I have been seeing patients in groups so that they can start supporting each other. And they really form nice support groups and support each other. And we also support them as a staff. And that's very important for them to have. Because that's one of the reasons that they don't necessarily succeed in society in a lot of these weight programs. I say we're bringing being overweight out of the closet. We're coming out of the closet. There's a lot of shame around being overweight and obese. And so, people don't want to get weighed in front of other people. Like, nobody knows that they're obese and overweight. Nobody can see it. I mean, come on, we can all see that. So let's stop trying to act like nobody else has this problem, and let's just come out of the closet and let's all deal with it together. So we all get weighed together, they all get weighed together, and we all are seen as a group. So we've just been very successful using these tools, and I'm going to talk about the program that we use. And then once they go through phase 2, if they've lost all the weight that they want to lose, then we put them on maintenance, and they still come in and get weighed and get the support that they need. If they have more to lose, then we just tweak their plan, and we do further testing. If we're concerned about more toxicity, we might do heavy metal testing. But some people have more severe nutritional deficiencies, so we might put them on nutritional IV therapy. It just depends on how severe their nutritional deficiencies are. I mean, that's kind of in a nutshell, without giving away all the juiciness of what we're going to talk about in March. Those are just the basics about what we're going to talk about, Dr. Taylor. Did you have specific things that you wanted me to go over?
No, no, Dr. Dunston. You did a great job, and I just want to say, when I started speaking, publicly speaking, probably in 2002, 2003, my hope was that I would affect a lot more people by speaking to doctors than I would by trying to have a huge practice. And when I hear you speak and see what you're doing down in Savannah, it really makes me proud that if I had any part in kind of changing your direction, uh, I'm just happy that what I thought I would be able to do by speaking has actually come to fruition, and I'm just happy that because you sound so professional. I'm so proud of you. You know, it makes me feel good. But yeah, I'm really looking forward to it because you've taken what I do and you have multiplied it. And that's the creativity that all these physicians have. I really think medicine kind of puts blinders on doctors and don't allow them to really reach their full potential. And I think that's why you are so happy in practicing this, because you see that you were capable of much more than what OBGYN was allowing you to do. So I'm just
Yes,
happy. Yeah, go
you
ahead.
have definitely been a catalyst in my life, so I thank you
Yeah,
in spades. Yes, thank you
yeah.
so much.
Well, again, I'm proud of you, and I know you're doing great work. Now we have Dr. Gutla. I think I'm saying this. She wanted to know if you use natural weight loss in patients with history of cardiac bypass and gastric bypass.
Yes, I do with gastric bypass. I have not had cardiac bypass patients, but I
Hmm.
would.
Yeah, I wouldn't think that you're doing anything that could possibly hurt them, and losing weight can only help them. And you're not using any stimulants or anything, are you? Anything that would stimulate the sympathetic nervous system? Uh,
No, I
yeah,
don't use it in renal failure patients or in insulin dependent, type 1
diabetics.
diabetics or
Yeah.
insulin dependent diabetics, right?
Okay. Yeah, because they can be very fragile and have blood sugar problems. So I don't blame you. Uh, because again, like I say, I don't take care of sick people. If you're sick, you need to go to a real doctor. If you want to get well, you come to me. So, insulin dependent diabetics, they cross into the sick problem. But I know doctors who do see them, and if you don't mind uh, dealing with the sugar issues, checking the sugars. I mean, I still think the type of weight loss that you're doing is can be helpful for them also. So. Uh, I don't think there's any more questions, and I'll tell you, you have been the most popular person from my emails, sending out invitations. You have drawn the biggest crowd. So weight loss is important. I don't think you can practice good medicine without helping patients lose weight, because weight plays a part in so many diseases and illnesses. I really think that you need to have something to offer the patient other than that calories in, calories out. Every time I hear that, I heard an endocrinologist at one meeting say that, and I wanted to go up there and slap him.
Oh
Uh,
gosh.
yeah, I wanted to go up there and just slap him silly uh, when he said it. It's just so simplistic, and it's not useful. It's not useful to anyone. The people who can benefit from that have already benefited from it, and the ones who can't are the ones who are coming to you. And I think a lot of doctors think that the patients are lying when they're saying that they exercise and they eat correctly and they can't lose weight, and they just think that the patients are deadbeat. But most of the time, the patients I see, they really are telling the truth, and I'm sure that's the bulk of your patients also.
Yeah.
Yeah. So, anyway, so Dr. Dunstan, I'm not going to hold you any longer. I really, 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 really appreciate you coming on tonight, and I really appreciate you coming to be with us in March. And we just look forward to continuing our relationship together.
Actually, I'd love to stay on and hear the cases.
Okay, all right. Well, we're not going to kick you off. We're not going to kick
Okay.
you off. Okay. All right. So very good. So I'm going to mute you, and then we'll go from there. And if you want to ask a question, you can just jump right in. All right.
Okay.
So here's what